We're just going to hear from Nicola. She's just going to give us an update, a summary of the annual disability and activity survey, and specifically focusing on the evidence that shows disabled people's lives have been hardest hit by COVID-19, and we'd be interested to get any thoughts and questions, and also just an update, the reopening activity and inclusive response. I believe that's hot off the press of an update, so Nicola will run us through that. And then I just wanted to kind of have a little quick reflect on the Sport England strategy, the new Uniting the Movement, and the 5 big issues, and just get some thoughts from you guys around what that really means to you, either as an individual or your organisation, the people you work with, support. And I think I said in my email, I'm quite interested to find a little bit more, or get a bit more of a response around the active environment. So I think some of the other big issues are probably things that we're already thinking about covering, but the active environment and kind of facility accessibility might be something that we haven't really spoken too much about. Then an opportunity for partner updates and for you to kind of give us an update on what you're doing, what you're planning, any questions, any opportunities to collaborate, share ideas. And then if we've got time, I wouldn't mind just finding out if there's any specific focuses you'd like for the next forum. So I will stop sharing and hand over to Nicola.
Can you give me permission so I can share my screen? I'm not worthy currently. So, yeah. But yeah, as Gemma said, I'm going to give you a kind of quick update on our annual survey results that have come out in the last month. Was it? Who knows? Time means nothing at the moment for me, but they're fairly new still. If you were so inclined, there is 100 odd pages of really data-rich information. There's also a nice summary that sits alongside of it. So I'd encourage you to start there. And then if there's anything in particular that you really want to drill down into, try and find it. There is, it's nicely accessible, so be able to kind of move across the document as and where you need to. And find kind of the more specifics if there are kind of bits in it that are really interesting to you or really important to you. And because there is so much information there, we could be talking about this for days, it feels like. So I'm not going to go into every single little thing, but me and Gemma had a quick discussion and we pulled out some bits that we think would be really interesting for you guys. But yeah, if there's any other questions that you've got, please do shout and I can try and answer them, or ask our research team who will be able to answer them a little bit better. But yeah, I'll make sure that we get the links out to everyone so you can see where it is on our website. There is a nice little recording as well on our website that our research team did, that kind of explains it in a little bit more detail than we're going to be able to do today. But yeah, do go and have a look at it. The kind of primary purpose for it that I feel is to support you guys, because I know that we're preaching to the converted. You guys are the ones that are out there being inclusive and delivering. So it's not trying to get you to be inclusive because tick, that's already done. It's actually about supporting what you're doing and actually helping to evidence what you're doing and why you're doing it. So when you're having conversations with partners, or maybe trying to get back into facilities that have been closed and that are being a little bit difficult to help you get in there, saying actually these are the inequalities that we know disabled people are facing currently. This is why it's important that we need to prioritise this group, or this is, it's just kind of put some kind of welly behind you to be able to support you to do that. So yeah, I'll click share now because I've been rambling enough already. Right, let's do that. Close that. Oh, I don't know what I'm sharing. Am I sharing the right thing? No. 1 second. Sorry, guys. That's what I want to share. So, lovely. Hopefully that's working for everyone. So yeah, quickly, before the pandemic started, we were making good progress, frankly. It was going all right. But we know that disabled people were still less likely to be inactive than non-disabled people. And but we were seeing a positive change. We were starting to make a difference. But unfortunately, that did kind of all go to pot quite quickly. Perceptions and motivations were changing, as I said. Fewer disabled people felt that their impairment affected their ability to be active a lot. More disabled people agreed physical activity and exercise would be for people like them. And yeah, the motivations were changing, but the top motivation still did remain the same, that they were to improve physical health, lose or maintain weight, and to get fit and improve mental health. But yeah, we were making a difference. That's the main thing we need to remember. The next slide is a little bit more, it starts to feel a little bit more depressing, frankly. So this is a little graph that explains how activity levels increase, decrease over the last year, essentially. So this is hot off the press. This is taken from Sport England's research that they've only just recently put out. So you can see at the beginning of the pandemic, so, you know, this time last year, between April and May last year, things were increasing. I think the novelty factor was still there for a lot of time. People felt that they had a lot of time on their hands. The weather was glorious. There was reasons why people were being active. That is both non-disabled people and disabled people. And then it took a nosedive, frankly, into October. So that's when schools went back, universities went back. We were eating out to help out, and numbers started to increase again. And that, yeah, absolutely took a nosedive. Tears, people were in tears. I mean, I can't remember what you guys, I think you guys were all right for most of the time, like me over in Kent. But yeah, it was a very different time. Yeah, frankly, numbers did absolutely nosedive. There has been a steady increase since then, but actually we can see that it's still not increasing, and disabled people are still very much more affected. And yeah, it's what we can expect. But as we start to reopen, hopefully with a lot of older people getting vaccines, that we're finding that actually they feel like they are more able to be active. It's, you know, they feel a little bit more secure in what they're doing, and maybe the confidence levels are starting to increase. But we're going to come on to barriers next as to why people might not feel like they are able to be active. So there's new barriers that the pandemic has created. The top one being people self-isolating, as you'd expect. And I think, when's that changing? Is that April? I can't even remember. But that the self-isolating, even though the government is saying it might not be necessary, doesn't mean that people aren't going to necessarily do it. I know a lot of disabled people that decided to isolate way before the rest of us this time last year, because it's what they feel safest doing, and they're going to continue to self-isolate until they've received both vaccinations or whatever they feel comfortable doing. So yeah, self-isolating is a massive one for disabled people. And yeah, if you look at the difference, it's 38% of people said that self-isolating is a barrier for disabled people, opposed to 13% for non-disabled people. So there's a huge difference there. And that probably also translates into fear of contracting the virus. Again, there's a lot more fear about that amongst disabled people than non-disabled people. So hopefully, as I say, as people start to see the numbers continuing to drop, hopefully, and more vaccinations happening, then if people are able to get vaccinated, then that might level out a little bit. Actually, the impact that's occurred for people's physical and mental health is huge as well. The amount of deconditioning that's happened because people aren't able to get to physiotherapy, or the hydrotherapy pool's been shut, or whatever it might be. I mean, I know for a personal point of view, my mum, who is disabled, she hasn't been able to get to the pool for a year, and it's had a huge impact on her physical and mental health. So it's something that's going to be, I know there's a couple of charities that are doing some research into that at the moment, about primarily around MSK conditions, and seeing how actually what's happened in the last year for that kind of population. And yeah, I could go on and read them all out, but lack of space at homes there, not having the right practical support, not knowing how to exercise at home, or not knowing how to access online sessions have all been huge barriers over this time. And actually, I don't think online sessions are going to go away anytime soon. I think having a blended approach is going to be important for a lot of people. I know it's a lot more convenient for some people just to, you know, stop work, I'll turn around and I'll be able to do my Zumba class in the middle of my living room, or, you know, whatever I need to do. So having that blended approach is going to be important moving on. So those were the barriers that affected disabled people more, but there are also new barriers that have affected both disabled and non-disabled people equally, or disabled people less. So actually closing of facilities, we know that now has actually affected disabled people slightly less. It's still quite significant, but it is slightly less than non-disabled people. Socially distancing when doing exercise, again, that's pretty much equal at 34 and 33%. But yeah, not having the right equipment there, caring commitments because of coronavirus, actually, that one you probably would expect to be a little bit higher than for non-disabled people than disabled people, and work commitments as well is higher for non-disabled people than just disabled people. Saying that word a lot and it's getting a bit much. So yeah, there's lots of new barriers that are out there. I quite like this. I think it's interesting to know actually what types of activity people have been doing. So you can see the difference between disabled people and non-disabled people again, and whether they're being active with people or by themselves. Oh, the other thing that's important actually is when we took this survey. So these results were all done over the autumn. So it was a trickier time. Numbers were increasing, we were in tears, we were heading into our second lockdown. So it's important to bear that in mind, that we're now kind of 6 months down the line, so we probably are in a slightly different place. So yeah, actually, with others is not many people were able to be active with other people. That wasn't particularly high. It's hard to it's hard to explain this slide particularly well, but it's, yeah, again, as I say, it's back in the summer and disabled people are less likely to do all of them, particularly with others, but still take part in a wide range and reflecting the circumstances and differences that people want. You know, not everyone's the same. So the only type of activity looking at this that was more equal or was self-led activities at home, indicating that that was probably the most appealing to disabled people, and that the efforts to get people active at home had a positive impact that we've all been doing over the last year. So I'm going to start looking at kind of the other inequalities, because, you know, one thing that we all do know is that disabled people have the inequality gap has widened over the last year, but this is also true for other inequality groups. So the proportion of people doing at least 30 minutes of physical activity 5 times a week, so that's being classed as active, is pretty low for women, lower socioeconomic groups and ethnically diverse groups as well, all around a quarter, 27 to 24%. But there's also been the new inequalities have emerged, so people without access to outdoor space, they've been a lot less active. Younger people as well are not being so active, and people living in urban areas, which probably correlate to access to outside space as well. So yeah, they're all things to consider moving forward. And then looking at different groups. So Gemma asked us to kind of look at the different intersectionality approaches to this. So I mean, as we all know, disabled people have a range of different values to them, and actually they might not necessarily feel that maybe they sit within a disabled group. They might not consider themselves to be disabled, so actually they may kind of attribute themselves more to being a woman or a part of the LGBT community or whatever it is. So it's important to look at how those groups have been affected as well. So yeah, different differences between demographics and impairments. And yeah, really looking at that person-centered approach, and we've got resources if anyone's interested in that. So yeah, it's all about identifying different identities for people. So the main differences that we saw for the other groups is that men have more fear of getting the virus and are affected more by the closure of facilities. Older adults are more likely to be self-isolating and not access online classes. People in lower socioeconomic groups feel that their activity levels have been less affected by COVID, although they are one of the least active groups anyway. So maybe it's because they didn't have a lot to work from, if that makes sense. And then gay, lesbian and bisexual adults were more affected by the closure of facilities, but were more likely to be active as home. So yeah, we saw so women particularly, and young people and people from a ethnic diverse background were more affected as well. For young people and the ethnically diverse groups, they feel that the pandemic has reduced their ability to be active, and they're especially affected by the barriers related to a lack of space and the lack of support and work commitments. And for women, their well-being and health was more affected, and they feel like they have less opportunity. Maybe that's because of other commitments around the home, or kind of other caring and work commitments as well. So yeah, trying to unpick the different identities that disabled people may have. And then finally, impairments. So we did kind of dig into people with multiple impairments and how they've been differently affected on several different measures. So people feel like that their impairment has gotten worse. They may be more affected by the different barriers, like lack of space and support and not having the right equipment. And maybe they have more specific needs. And also, like a lot of disabled people, they felt they haven't got enough information on how to be active at this time. So there's lots of differences by impairment type, which have been summarised in a separate report actually. So these are just a few of the examples on there. So people with learning disabilities and sensory impairments were particularly affected by the pandemic and these new barriers more so than anyone else. So yeah, that's a quick overview of impairments. But yeah, if there's anything in particular that you want around different impairment groups, do let me know, because as I say, we've got that separate report that we can share, and that might be helpful for moving forward. So we did have some conclusions and recommendations from our survey. There, as I said, there's nothing's come out of this survey that we thought would be revolutionary or is going to completely change the world. It's all stuff that we knew. It's just important to have it as evidence, and we've got it as, you know, real insight that we can use moving forward. So our recommendations would be to 1, provide clear and consistent information about being active, as there's been a lot of confusion around what people can and can't do around being active. I know kind of early on, a lot of people who were carers didn't know if they could be active with the person they're caring for and be closer than 2 meters towards them, or whatever it is. So yeah, clear and consistent information about being active, and we need to make sure that our reopening activity stuff is really important and is being shared as well. So we'll kind of come on to that in a minute. Number 2 is to embed inclusive practice. Just inclusion needs to be at the heart of everything that we're doing moving forward as we recover. Work collaboratively, and we're doing that by everyone in this one virtual room together, which I love. But yeah, particularly around the health sector as well, and community organisations. 4, we need to offer a variety of ways to be active, and I know we've already it's already said that people are going to be offering blended approaches and that kind of thing. And then lastly is to change attitudes towards disabled people being active. So yeah, we need to increase the visibility of disabled people being active and challenge perceptions on different impairments as well. So for our reopening kind of work that we've been doing, the guide that we put out from whenever we were last able to reopen, was it in June, July, around that time? I think it was. The guide is still just as correct and just as used as it was. So the guide is the same, but actually what we want to really push this time is why we should be using it. As I said, it's not for you guys. I know you guys are doing everything that you possibly can do, but maybe this will help maybe the facilities that you're using or people that you're working with who maybe haven't got such a grip on it. So the first thing we know is that disabled people weren't receiving enough information. There was hugely high levels of anxiety and nervousness about returning to activity. Almost 3/4 of disabled people feel that the needs of disabled people have been overlooked during the pandemic, and 59% of disabled people worry about leaving the home to exercise. So it's that level, that anxiety and that nervousness is so high. So what we need to be able to address that. But the good news is that disabled people do want to return to activity. The want is there. So as long as we get the way we're doing it right, it shouldn't be you know, terribly difficult. So what do we need to do? First off, we need to ensure that inclusion is at the heart of all of the plans that everyone is putting together, and guidance documents, and, you know, hopefully your NGBs are making sure that inclusion is really at the heart of what they're doing, reopening wise. We should be consulting and engaging, so making sure that members are being worked with and actually asking, what are your fears? What do you feel, what would make you feel safe? Or this is what we're planning to do. Is this going to work for you? Or what else do we need to do? We need to give the you know, who are working with the confidence to come and to address their challenges, and not everyone will wish to come back at the same time either. So you just need to be ready for when they do. We need to ensure that the information that we're providing is clear and concise and simple and easy for you know, your workforce to deliver, and yeah, just make sure that everyone's on the same page, because that can make a real difference on that first visit back. That could be make and break for people. So yeah, inclusive communications are critical. Really think about whether actually, if there's going to be a new one-way system for people to come into the centre that you're using, actually would a walk-through video be really helpful, so people can have a look and go, actually, we're not going to be able to turn left where we used to have to turn left. We're going to have to go around this long way, and this is where the route is, so people are aware of what's going to be happening beforehand. And actually, what activity are we going to be doing when we first go back? Because people's activity, well, their fitness levels aren't going to be the same. So yeah, we need to consider what actually the activity is going to be doing, and actually just reconnecting with disabled people's values. They've probably changed a lot in the last year. So yeah, really think about what's important to the individual. So I've popped up our little, I mean, it's a really lovely sketch of a person. I don't, hasn't got any hands or feet, but that's all right. I didn't draw that, I'd like to point out, although my drawing would be probably a lot worse. So these are kind of what we know are important to people, not just disabled people, to everyone, to make them fulfilled, happy, and have a sense of self-worth. So actually, last year when they were attending sessions, it might have been they were attending purely for their health or for friendship, but actually now they might be turning up to a session because of their mental, to improve their mental well-being, or to friendship and connections are going to be hugely important moving forward. So yeah, just consider what people want. And then finally, yeah, so they're kind of bits that we did talk about, but yeah, remember to adapt to that person-centered approach. And I think, Jem, that is everything from me. And that was only 20 minutes, that wasn't too bad. But yeah, as I say, I could have gone on for hours about our research. There's so much stuff there. But please do let us know if there's anything in particular you wanted to know. I will make sure that we share the links to where it all is on our website, so you can get the recording. And if you want to read the 100-odd pages, you are more than welcome to, but I haven't, so good for you if you do. But yeah, the summary would be a good place to start.
Brilliant. Thanks, Nicola. That's great. I mean, I attended the Disability and Activity Survey webinar, which was an hour and a half, wasn't it? Anyway, and so yeah, to try and condense that all into 15 minutes was really good. So does anyone have any particular comments or kind of thoughts that they'd like to raise? Yeah, Shani?
Just to say, I thought that was really good. Thank you for that. And it's always really helpful to get things fed back really simply as well. I make notes as well as, but I will be sharing that in my workplace to my team and with managers, because it's really, there's some sad stats there, isn't there?
Yeah, there really is. And I didn't even go into kind of loneliness and bits around that. Like there's bits in it that we know it's there, but actually just seeing the stat in front of you is like, is it really that bad? Like it must be. Yeah, so yeah, I completely agree with you.
Paul?
Yeah, I agree. Thanks for the summary. I thought that was excellent. Really sort of explained a lot of probably all had some idea of, but seeing it all in one place is great and really helpful. I think one of the sort of, I saw yesterday the figures of 40% of people are really nervous about getting back, and those sort of, what I saw was just one figure, and in itself you couldn't read as much into. I think the fact that there's such a significant number who are, where we probably on this call, most of us have been some people who will be straining it a bit to get back. I think where people have that nervousness, there'd be as a significant holding back for some time, or something of actually the things that we need to do to really support people. And I think that's one of why the detail people have is so complex, so much information, often 2 or 3 sheets of A4, even in smallish print, can be very off-putting, even for those of us who really are involved in actually getting the activity going, let alone for people who are sort of nervous as before about coming into the activity, and how we actually make that information the important information that people are able to get, but also that they're not overwhelmed by how difficult it sort of all sounds. So that when they do come in, it is actually a very positive and enjoyable and supportive environment for them to come into.
Bob.
Yeah, thanks for that, Nicola. The stats are very useful. The amount of reports and proposals and stuff we put together recently fighting local authority cutbacks, it hasn't helped, but it's definitely, it's there in your face, and if they can't take that on board, it's a shame. Fortunately, we've been using the outdoor disability sports groups exemption to keep people active when we can, when the weather's permitted, last year, and we started again this year, I'm glad to say, with the support of Chi Uni offering us some of their facility. And the steps back that you've put in place, we've pretty much put that, we followed that, and it is very important, I've got to say, to make sure that it's adhered to. We were quite reticent about what sort of take up we would get, whether people would be very fearful and come back, in very low numbers, or, if at all. But we were quite surprised that we've had the same amount, if not more, people want to get active again. So that's a really positive, outcome at the moment.
Bob, on that, kind of reflecting on what Paul was saying, did you do anything specific around kind of that information piece and making it really accessible and, taking away that overwhelming kind of notion of so much information?
Yeah, it's, when we were able to get together as a team last year and come up with this plan to get people out again, we were very, very focused on how we could make it less, how can I put it, there's so much bad news about how can we make it more attractive, how can we make people, want to get out and become active again and take some of that fear away. So easy read stuff, speaking to people on the phone, taking the time just to, tell people in writing and verbally what we'd put in place to keep people safe, taking people's temperatures, wearing of masks, social distancing. The sessions that we put together were not sports sessions, they were keep fit sessions, so there was no physical contact. The use of equipment was kept to a minimum, and just really, making sure that everybody understood that before they came to the sessions. And I've got to say that, touch wood, it's all gone very well, better than I thought it would do, to be honest with you.
Sounds like a nice little case study, that one, to me, Jan.
Yeah, definitely. Jackie,
I just interrupt? Shani's just phoned me on my mobile to say that her laptop's just gone.
Okay, she has frozen.
She's trying to log back in. She's wondering if you can send her the link to her iPad, which is Shani Collins.
I think she's back.
She's back, Jackie.
Anyway, I did my bit.
Brilliant. Thanks, Jackie.
Actually, sorry, Gemma. Thank you. Gemma, if it does it again, my laptop, that was wasn't an internet thing, that was a laptop malfunction. And if it does it again and I disappear, would you be able to send that link to my personal email?
Yeah, if you.
Oh no, she might have gone.
Yeah. Okay, I'll wait for Jackie to come back and then ask. Jackie, can you put the email address in the chat, or email it to me, because she's dropped out again, so her personal one. So while Jackie's doing that, does anyone have any other questions specifically around those two documents and reports? No, brilliant. Okay, I'm just going to email this to Shani quickly.
I think I've remembered it correctly, but it might not be, sorry.
All right. Okay, done that, right. If not, we will move on to the Sport England strategy, Uniting the Movement. And just before we do, I'd like to say hello to Danielle, who's managed to join after some technical details as well. So Danielle, just to let you know, we're going to talk about the Sport England strategy, and then we're going to do some partner updates. So that will be an opportunity for everyone to introduce themselves and yourself as well. So the Sport England strategy, which hopefully most of you have kind of seen because we've been shouting about it a lot. So Uniting the Movement is new 10-year strategy. And, personally, I think it's a really refreshing strategy. It's really reflecting on not just obviously what's happened over the last kind of year, but the change and the movement that Sport England were making before that, in terms of really understanding people and place, and looking at the heart of communities and how we can support people to move more through physical activity and sport. They've obviously done a lot of consultation, and some of it obviously was happening over lockdown, but they consulted with active partnerships, governing bodies, lots of different organisations. So hopefully, if you if you were part of that consultation and you feel like you've been listened to, and on behalf of any of your members or service users. So I don't want to kind of go into too much detail. What I just want to kind of reflect on is the 5 big issues, and then, like I said, just get some thoughts from yourselves, and then maybe specifically draw on the active environments. So in terms of the 5 big issues, the first one is recover and reinvent. So that is very specific to obviously the situation that we're in at the moment, and recovering from COVID, but also using it as an opportunity to reinvent and look at the sustainability and opportunities, and really look at those kind of inequalities that we know exist. Connecting communities is the second big issue, and that's around being ability to make better places to live and bring people together. So we know that without working with our communities, we won't help to get more people active. So they are central to supporting this strategy. Positive experiences for children and young people. So Sport England have said they're going to have an unrelenting focus on positive experiences for all children and young people, because they know that that is the foundation for a long and healthy life. So we will continue to do work with the primary schools through the premium, and also working with our secondary schools and colleges. And we have kind of rebranded what we did have as satellite clubs to our children and young people investment fund. So although it's still kind of underpinned with some of the satellite club ethos around connecting community clubs or community physical activity provision to schools and trying to obviously integrate and engage young people, it's very much around what the needs are of those young people, and not necessarily it always being focused on that school kind of setting. We are also looking at kind of the tackling inequalities and using some of the experiences and learning from that with the children and young people framework. So we're doing a lot more around understanding people's voices. So if you attended our Active Sussex Network conference, we did have some videos for some young people that were really telling us what their challenges have been and what would engage them. The fourth one is connecting with health and well-being. So looking to strengthen the connections between sport, physical activity, health and well-being, so more people can benefit and advocate have an active life. And I think, I mean, this is something that we've all probably been doing in some guise of trying to work with, you know, health and wellbeing partners, and there is some, you know, fantastic work going on, but I think there's still a lot of work to do in terms of working with the health and social care workforce. The social prescribing kind of system is evolving, it's developing at quite a speed, and there's lots of work that we're doing locally, and I know some of you guys are already kind of connected in, but I think that's going to be kind of a fundamental element of really supporting individuals in their kind of journey to start moving. You know, they're not necessarily going to come or, you know, see a social prescriber because of their physical activity levels. It's, you know, going to be because of something else. It might be debt crisis, it might be their mental well-being, but we know that, you know, getting involved in physical activity or even just kind of walking can really support them. So it's about trying to integrate those conversations with those social prescribers, and then ensure that those social prescribers know what activities are available. One thing that was interesting when we have been meeting with social prescribers is around how they communicate with people with a disability, and especially individuals with a learning disability, adults with a learning disability, and kind of almost going back a little bit to what Paul was saying about that accessibility of information and how they make it kind of really accessible, and ensure that they are providing the right information. So there might be a little piece of work in terms of the Disability Sport Network and supporting the health kind of workforce, and specifically social prescribers on that element. And then finally, the fifth one is active environments. So creating and protecting the places and spaces that make it easier for people to be active. I know that, you know, we've had the exemption for disabled people in terms of being able to be physically active outside. And that, like Bob was saying, is probably, you know, being a godsend for so many people. So it's about, you know, obviously continuing to use those spaces, but also thinking about, as we go back into kind of facilities, what facilities are available, are they inclusive, accessible, and, you know, referring back to Nicola and the Activity Alliance report around reopening, how can we really champion those messages and make sure that those facilities are considering disabled people, and they don't just think, oh, it's too much of an effort, so, you know, we're not gonna support them at this time. So that's a real quick whistle stop overview, and I will again send the strategy link out afterwards, and if you've got any you know, real in-depth questions about it, then please, you know, drop me a line. But I'd just like to open it up really to the group to see if you've got any thoughts, any questions, how it kind of resonates, or if there's anything specific in terms of the people that you support or work with. Loretta.
Hi, yeah, I'm on an angry rant today. So for the past few months, I've been talking to the LTA, and we're now involved in their ideas group, so looking at inclusion throughout the country, which is fantastic and seems really good, until we find out this week that our local park courts have been taken over by the actual tennis club in the park, so there'll be no more free community access. So they're taking away community access, they're charging people £3.50 for half an hour on a court. So straight away, anyone in poverty is out. The only booking system is the website, so anyone who hasn't got internet access is out. And this is something I've been raising for months to say, don't do this. Make sure, if you're going to give the clubs to the courts to clubs, make sure there is a allowance for local community to use those courts, because we've now got an area of high deprivation with no tennis courts that are open to the community free of charge, and that's just horrendous.
Thanks for raising that, Loretta. And I think this is the type of thing that is good for us to know, so that we can try and help advocate and support you in those conversations. And I mean, it sounds like you're already doing that as best you can through the ideas group. But I'll take that back to Tanya, who's actually on the board of trustees, who works for the LTA, because these are really things that we need to kind of keep pushing and raising. Anyone else have any kind of initial thoughts? Bob?
Sorry, I don't want to be the only one talking. I just thought it's worth saying, obviously we've been doing the outside stuff, but when we have been able to get back indoors, we've used facilities in Crawley, Chichester and Bognor, and I've got to say all of them have been really good in helping us get our heads around their booking systems that obviously they've put in place now to limit numbers. And in some cases we've had, probably been given a higher priority than others. So, our initial interactions with them, although we've been using these facilities for years and got good relationships already, our initial experience of using the new systems is pretty positive.
That's really great to hear, Bob. That's really fantastic. And I think, having those existing relationships, to some extent does help and does support. Was there any indication from them around that kind of moving back and the importance to them of working with you and ensuring that they were making it? Just trying to kind of think of it from their perspective and how we're having conversations maybe with other facility providers, and using that as a bit of a kind of a leverage of why they see it as important.
Yeah, obviously, our position, we were on the verge of, we lost our funding through West Sussex. Fortunately, we had a last-minute lifeline from Sport England, and we are able to carry on now. So that's great, and thank you all for your support with that. Yes, the general message that we're getting back now, because obviously we were trying to lay some groundwork with these guys as to if we did have to stop providing the service, could they pick up a provision for people with disabilities? So we were actively, working towards that, outcome. And I've got to say that all of them have been very on board with it. Obviously, we've got to come out the other side of this, and when facilities open up properly and need to start operating to recoup some of their money, there could be a change in that. But I'm hoping that, that won't happen, and that, the work we've been doing about reduced access fees, reduced membership fees, keeping people engaged and having a member of staff that can assist with that is going to be really important.
Great, thank you, Bob. Richard.
Sorry, I was looking for the raise hand button on the thing, I couldn't find it. But yeah, I was just wanted to echo what Bob was saying there. Our concern is that facilities are going to be raising their prices across the board, as they'll need to naturally as a business because of the massive losses they've got. But whether that blows us out of the water to provide a sustainable activity that we can continue doing. So yeah, that's a slight concern that we've got at the moment. But we're being supported by Sport England to run double sessions and stuff when we're allowed to at the moment, which is fine. But that funding's not going to last forever. So I don't know. It's something that I guess we're all going to have to come up against. But maybe some support collectively to broker those conversations with providers, just to try and make sure that there is access and affordable access for people with disabilities and the groups that support them in the area.
It's just following on from Loretta, actually, just with regards to the tennis. PS, sorry about the lighting. I've got a new laptop and it's really very sensitive where I sit around. With regards to the tennis provision, we are actually looking to have, we've been working with the LTA for some time regarding having a booking system in one of our courts to have, it sounds very similar to what you've got. But with regards to obviously community provision, we're very keen to obviously still have an element in it. So I would say, before going back to, I mean, LTA is obviously very important, but I would say regarding the actual local authority, maybe having a chat with a sports development team or wellbeing service like we are, to just see if is there any possibility of tweaking the booking as such, because I think we're looking to have it from dusk till dawn sort of thing with slots. We aren't actually putting a cost on it yet, but it will be something where, you know, people would need to book. We get lots of stats from it, which I think, you know, again, we need to justify having facilities and actually the usage of them. So if you just have a court where you don't know who's using it, obviously, you know, we're not going to replace the court because we don't know how many people are using it. So I think it's very important to have systems like this in place. But I agree, you know, the point is you just have to have the chat with whoever's important about it. And going on for obviously what Bob was suggesting as well, going forwards, I think going directly to the leisure provider as such, obviously that's important. A lot of those teams who you might normally chat with are probably still furloughed. They might not be coming back straight away. So again, I think it's still important to engage with the local authority and raise your concerns. I mean, we have a local Crawley Disability Forum, which already we're having discussions about going forwards, you know, when can people get in the swimming pool, and you know, we're already having discussions with our provider to say, you know, there is a demand creeping up here, and as you rightfully said, I think what Nicola was suggesting about swimming pool, you know, it's been a year since a lot of clubs have been able to access the swimming pool facilities. And I'm hoping that if we get the timing right, I get the literature out when we know that, you know, the time we're able to get back in the pool, you know, there might be an increase. I'm hoping that there'll be a big increase where, you know, they're desperate to get back in the pool, or it could be people who've never been in the pool, you know, actually back to swimming. But again, you know, we have to wait and see on that one. But I think it's really important to have early discussions with the local authorities, sports developments or wellbeing services, you know, to get your word in, sort of thing.
Thanks, Matt. That's really useful from a local authority perspective. So thank you. Shani?
Just really briefly, reflecting on what Matt has said around that, I'm currently approaching parts of we have a healthy lifestyles team at the local authority, come under public health. So, you know, I'm putting in requests around things like that because there are underspends around. You know, there are underspends because of delivery has been different. So, you know, I'm just really kind of saying, yeah, you know, I'm also doing that. So, and also apologies, I have no idea. I think my laptop's gone into overdrive. So if I disappear again,
not a problem. Don't worry at all. Yeah, again, thanks, Shani. I think, yeah, that's useful to know for those, you know, community providers to reach out to the local authorities and those teams and really kind of highlighting the need, and like you say, the demand that, you know, we hope that will be there as well, and have those conversations early on, kind of broker those opportunities. So just wanted to ask if there was anyone else that wanted to kind of contribute or raise any thoughts around the strategy in general. Arup.
Hi everyone. I think really, and I'm sure everybody's the same, but I haven't really had a chance to look at this stuff, partly just working one day a week and just holding things support. But for us, it's just all about recover at the moment. And I'm sure everybody's saying it's just, you know, we're going to be coming back into full circulation just straight after the Easter break, and our sole focus is just getting things up and running and getting people coming back. I suspect it will involve connecting communities. There's definitely been some reinvention along the way. I will get around to social prescription and all that sort of stuff eventually, but for me at the moment, you know, I can't think about, and I'm being driven to think about nothing more than just getting things back up and running. You know, I went on the launch of the strategy and stuff can't even remember what it was about, to be honest. I was looking through my notes frantically going, what did I write? And I was like, I can't even find it. So, but yeah, so I don't want to kind of say it's not important, and I suspect all these things will happen as part of the process. But that's kind of where we're at the moment.
Right, yeah, no, and totally take on that on board. And I think a lot of people are going to be in that position, and it is just about kind of that recover and starting to roll things back out again. I think the thing about the strategy, and I know, we're kind of talking collectively here probably about the next 6 months, the fact that this is a 10-year strategy and this is about a long-term kind of investment into people and helping them to get active. It's not something I said you need to go away and know it all and kind of really look at where your programs are fitting in, but I think it's just really refreshing and a really fantastic kind of move in the right direction in terms of physical activity and sport. And what I kind of feel, and Nicola might want to chip in here, is how so much of it was being underpinned by kind of inclusivity and about from, I think, because of Tim, the CEO's background, he is an advocate around provision for disabled people. So it's kind of within all of it, that kind of intersectionality that Nicola talked about as well. It's going back to the person and the needs that are there. So yeah, anyway, that's my 2 pence for 2 pence a bit. Nicola, did you?
Yeah, I mean, I don't think I can add much else, but for me, it's the first time that it's actually felt like it's been running through the whole of the document, rather than it just being, we're also going to be looking at disabled people, also going to be working with LSEG. It's actually the first time that the main theme is around tackling inequalities. So actually it feels a lot more joined up for me, and I think that's only going to be a big positive for us and what we're doing, but the whole sector and how much that hopefully we'll be able to achieve in the next 10 years. So yeah, I mean, we don't have anything to do with it. We consult on it like anyone else. So yeah, it was really nice for us to see that what we're talking about is being heard.
Great, thank you. Paul.
Oh, hello everyone. Sorry, I've been quiet so far. Not like me, is it?
Not like you.
Just to add, I think it's fantastic actually that it is so embedded in that strategy. I was really quite enthused by it, sitting and listening to the webinar and things like that on it. So I'm really positive around it, and I think it really shows that anyone that might have seen it, the FA launched their new grassroots strategy yesterday, and buried down on page 20 something or other is a mention around kind of disability and things like that, after mapping out their men's participation bit, their female participation bit, and then somewhere buried at the bottom was, oh yeah, we want you to be really inclusive as well. So there's quite a stark contrast between the two. So I'm really hopeful that appreciate it's going to take some time to really embed. Actually, if it's been being driven from the top with Sport England, then hopefully that'll force other governing bodies and things like that to really fall into line with it and make inclusive practices a really important part of it.
Thanks, Paul. Yeah, that's a really good point. That's a shame about the FA strategy. I haven't seen or looked at it, so yeah, that's a bit disappointing. Great, and thanks, Loretta. I've just seen your other point, and you do give us a shout and see how we can support. So Sadie manages the relationships over in kind of East Sussex. So if she can kind of provide some support or weight with those conversations with the local authority as well, kind of do keep us posted. So unless anyone had any final thoughts, I will look at any hands up. Nope. Great. We will move on to partner updates. So we've got about half an hour, but if you do need to leave, then obviously kind of feel free. This is just really, you know, an opportunity for you to kind of say who you are, what you've been doing, or what you're planning. And if you have any questions, you know, you don't feel obliged you have to kind of say anything, maybe just introduce yourself. But I think it's just a really nice opportunity for network members to kind of connect and share their ideas, and then kind of, ask any questions. So Matt's got to go, so thank you, Matt.
No worries. Yeah.
Do you want to say anything quickly before you go?
Yeah, good idea. Yes. So basically, we're obviously looking forward to obviously hoping to start to open up our provisions in the near future. Obviously, we look after recreation club at K2. We work in partnership with the Flamingo Swimming Club. Obviously, I can't find Bob now. I think Bob's vanished. Oh no, he's off screen. Obviously working with the Out There project. We've got Wheels for Wellbeing sessions again. We're looking to start them back up when we're able to, staffing issues, etc. But yeah, we're all looking forward to it. Let's just hope that everything keeps on track with the roadmap, and hopefully, you know, we can really, you know, promote all this provision going forward. It'll be fantastic.
Brilliant. Thanks, Matt. Thanks for joining, and we'll catch up soon. So, Paul Gillett, I'm going to go around the circle of things I can see. So yeah, Paul Gillett, if you'd like to go next.
Okay. Thanks. For those who don't know me, I'm Paul Gillett. I'm involved in East Sussex Vision Support. It used to be known as ESAB. We recently changed our name, trying to rebrand. We were more of a focus on the sort of support we can provide, rather than necessarily just we're there for blind people. So to be looking to encourage more independence, more activity, and so it's a great opportunity. I was pleased to see the word Reinvent alongside recovery, which sounds, I think, very much part of what we can do this time. It's an opportunity as well as a big challenge over the next few months. So we're starting to sort of get things together, get opportunities to really talk through what is achievable, the challenges we're going to face in the next few months, and what we really want to sort of see the organisation becoming in terms of services for blind and partially sighted people in East Sussex, Brighton and Hove. The organisation tends to be sort of, there is a age profile which is more towards the older range, and that's an impact. I think a lot of people have become less active over the recent months, and so we're going to need to be looking at what we can do to make our services more geared towards that area, encouraging both where people have that access to the technology in terms of sort of providing online resources, but also getting people out to do activity, and as it becomes more possible, perhaps using the facilities that are around indoors as well. So sort of a new stage. So been frustrating this last year not being able to do so much. I'm also involved in sound tennis, and our first session this afternoon, which so looking forward to. It's so great to be back on the court, and as I'm sure everyone else, looking forward to getting back and to doing activities. Looking forward to finding ways to reach out to more people. I find as we talk to people, there are some who are saying, yes, we want to get back, but not yet. But also a number of people who just can't wait.
Brilliant. That's really great. Maybe if you could send some information about the rebrand, we can kind of promote it in the next Disability and Inclusion e-news.
Yeah, okay.
Arup.
I think apart from Nicola, I know everybody on here, because I think, is it Danielle? Danielle's disappeared.
Yeah, it looks like she's dropped out. She was having some technical issues, so.
Okay. So Nicola, for your benefit, I'm a disability cricket manager at Sussex Cricket. We do a lot of work with you guys anyway through the ECB, and I know you're heavily involved in our training programs for disability cricket coaches and stuff. So that's my background. Where we're at, we are effectively coming back. The whole of so I sit in the community department. I run the disability team there. The whole of the community department, most of them have been furloughed for the last year or so. My team, none of my team, my 3 guys, have worked since the end of March last year. So they're all coming back. We're all back on the 19th of April. So it's very much a case of getting things up and running. Having said that, I am slight, and this is really for the benefits of Bob and Al and Richard and you guys who I work with directly. I have got slightly constrained capacity in that I've had to release my guys to deliver a lot of mainstream schools work because we are unsurprisingly inundated with requests to deliver stuff. So we're short of capacity, and we're not in a position to use contract coaches on our roster. So all the work is essentially the same workload but delivered in-house, which has proved quite a challenge for my boss. So, but we are back, and we will look at booking stuff in. I've already booked stuff in with Liz at Great Air. We will be starting our weekly Super Ones disability cricket clubs. We were at 8 before the pandemic. We are now going to come back with 6. So there's a couple that aren't going to restart. One in Pulborough, which was never going to restart irrespective of the pandemic. It just didn't work out. And the other one is Eastbourne, which leads me on to the next point, which is an exciting project that and the reason I'm late is because I was making sure I had all the answers to Loretta's questions when we meet tomorrow. But there is a new initiative that's been launched by the ECB to get cricket clubs to set up their own disability sections, and we are supporting them to do that. So this year, I'm hopeful we will get 5 clubs through. 3 have been approved, 1 more is about to be approved. Over in the Eastbourne area, we're working with Polegate and Stonecross Cricket Club, and we are essentially going to help them set up a section, a disability section, which is going to run through the summer. And my club that I ran in Eastbourne, I'm effectively going to transition over to Polegate and Stonecross Cricket Club. And the forward-thinking cricket club that it is, they are working with Defiant Sports and Loretta's team to deliver the cricket section. So Loretta's multi-sport portfolio doesn't have cricket on it at the moment, so we're going to get Loretta's team trained up to deliver some cricket sessions and see how we go from there. So that's a really good example of reinventing, connecting communities as well, and looking at active environments. So whilst I was a bit bar humbug about having had time to think about this, the ECB have thought about this stuff and are putting initiatives in place which are commensurate with the New Sport England strategy as well. So there's going to be Polegate over in the east. In the central area, we're going to be doing stuff with Anstey Cricket Club, Burgess Hill area, Middleton Cricket Club over in the west, Buxted Park, also in the east, have submitted an application which should go through, and then in Brighton it'll be St Peter's Cricket Club. So that's the kind of new stuff that we're doing, which is really exciting, and should hopefully be the platform for cricket being more accessible in much more local communities rather than having to travel 15-20 miles to come to a session that we're putting on. It also frees up some capacity for us to look at other geographical areas where we're not delivering much disability cricket. But essentially, in short, we're back from the 19th of April. The doors are open. I may have limited capacity, which might unfortunately mean you might see more of me coaching than some of my guys, because I'm not going to be doing so much mainstream school stuff. So, but yeah, we're back and ready to go from the 19th of April.
Brilliant, thanks, Aru. That's really great to hear, and like you say, a great example, and hopefully some nice case studies out of that. Loretta. You're on mute. We'll move on to Bob, and then you can have a look, and we'll come back to you.
So I need to sign off now. So see everyone.
Okay,
Bye.
thanks, Paul. Lovely to see you. Take care. Bob, do you want to go for it?
Yeah, sorry, I had to jump off for another call, so
All right.
I lost the thread of it a bit. Sorry, where are we?
Just giving updates on what you got planned.
Okay.
Yeah, it doesn't need to be too in depth. Just
Right.
Quick overview.
Yeah, to keep it very brief. So as I said, we've secured another year's funding from Sport England yesterday, so that's a really good start to the week. And as I said, thank you for all the support that we've received from everybody across the board, but especially Active Sussex. Recovery and Reinvent, basically the big thing yet again. We've got 2 regular sessions going on at the moment, Crawley and Chichester, that are well attended, and we want to obviously build on that, being conservative within what we can do. So for us, yet again, the use of outdoor space is, very important at the moment. And we probably will go forwards with a combined program using facilities, indoor facilities, and still keeping links to outside stuff as well, because I think the guys have actually enjoyed it. The change has been good, it's been positive, and I think having a varied program, a bit more of a varied program going forwards, will hopefully attract some more clients as well.
Brilliant. Thanks, Bob. And I'm so pleased when I got that email last night. What I said, I did a little run around the house, and
yes, imagine you doing that little dance. I appreciate it. It's great. Thank you.
So yeah, fantastic. And well, it's a fantastic service, and it's just a shame that the council obviously couldn't fund it. Appreciate there's a lot of complexities over there, but yeah, so pleased.
Right. Thank you.
So if we go to Richard.
Yeah, thank you. Great news about out there as well, by the way. So at Worthing MENCAP, so I'm the operations manager at Worthing MENCAP. We run a club called the Sussex Seals Club at Worthing Leisure Centre, and we have obviously, we did get back up and running again during the middle of last year after a bit of a break due to lockdowns, but we were going nicely again, and Sport England supported to fund us to run double sessions so that we could support social distancing. So just in the interim period, obviously with the new restrictions in place, we had to stop again. Our plan is to restart on the 6th of July when we'd naturally start our summer activity term. That's all subject to the roadmap going as planned. But in the meantime, we've been running online Zumba sessions, which have been really well attended, and even people that don't normally come along to the Zumba group within that within our club kind of dip in as well, because they just want to be active at home and see their friends, and it's not just all about sport for our guys, it's about access to meeting up with their friends. So that's been going well, and we've also been running an online seated exercise group, and that's been going really well. We've been adding in a Monday morning general kind of exercise group, and that's with funding from National MENCAP and the Round the World Challenge, and we've got about 30 people signed up for the Round the World Challenge, and people are really enjoying that. A few people are aware of that on the call, and have got funding for that as well. So all in all, we're supporting about 60 people a week to access the online sessions, which is great. But we're going to look to bring that back into more face-to-face stuff. We're very conscious that not everyone is able to access online. There's people that don't know how to, or don't have the internet at home, and those kind of things. So we're very keen to be starting to re-engage with people, which we are going to be slowly doing at our base in Buddies in Worthing. We're going to be starting things like walking groups with some of the Sport England funding that we've got, and doing some face-to-face exercise sessions in the local parks and things like that. When we're allowed to, again, a bit further down the line, probably July onwards, we're going to be running a gym and swim session, which is something that we've taken over from out there in the Worthing area at the Splash Point Leisure Centre. It's a well-established session, but we're carrying it on when we're allowed to do so. We haven't quite had the conversations with Splashpoint yet, and I think it's still very much up in the air. And when not that just going to be opening, but allowing groups to access the facilities, because obviously that's another hurdle a bit further down the line. But we're fairly happy with what we're able to do at the moment, and people are engaging well with it. But we're looking to, restrictions to be eased and us all to get back up and running, as I'm sure everyone else is.
Brilliant, thanks, Richard. That's great. And yeah, like you say, the Around the World Challenge, it's been fantastic actually. I think the target was around 120, wasn't it? And across the 6 partners, I think, that signed up and are getting funding from National MenCap, I think we'll achieve beyond that. So another great investment into the county and a great project. So Loretta, should we try and go back to you?
Am I here?
Yeah.
Excellent. Right, do excuse my background noise, but very excitingly, we have our home ed PE sessions back on. So the rowdiness is all the kids, I'm afraid, but that's obviously a good thing.
A lovely noise.
Yeah, it's a lovely noise. It is very much missed. Right, lots of updates. Obviously, Roots already updated you on one project we're working on, and the same as Paul, our sound tennis sessions are going back shortly. So 9th of April, we start that again with a taster actually in our venue, because although we've been here over a year, we haven't had a chance to do tennis here yet, strangely. So yeah, that will be fun. We are also, we have our kids activities back on now as part of the wraparound care thingy, and outdoor football goes back with us this week as well. So that's all very cool. Then we've got the Easter holiday programmes coming up for the East Sussex funded places for children and free food. Round the World Challenge, we're running 2 weekly sessions for that from April. We're midway through working on an accessible beach project, which kind of fits in with the spaces thing, because we want a decent accessible beach in Eastbourne. So we're working with the council and some other providers locally. And we're trying to put a bit of a sports court on there, obviously, because we're doing it, so we're going to want sports, and equally social sort of leisure area, so we can get everyone onto the beach with the same access as each other. Most exciting piece of news is our Festival of Accessible Sport, which is now booked 28th and 29th of August in Princes Park, Eastbourne, and on the seafront next to that, we're going to be hosting 2 days of accessible sports activities. So we want everybody to come and join in. If you want to come down and do some tasters, give out flyers, tell everyone about what you do through Sussex, very welcome. There's no cost for any providers to come and join in. We just want you to be there. So it should be a really nice weekend. I will be sending an email across next week so that people can fill in forms and send me boring stuff like insurance and things, but very exciting times. So, and I'm learning lots about event management, which is another steep learning curve that I didn't really want to start, but hey ho. So yeah, that's us in a nutshell.
Brilliant, thanks Loretta. And yeah, if you send that info, I can then obviously distribute it to the wider network. We might get inundated on requests though, so brilliant, thank you. Ricky.
Hello. Hi everyone, it's great to hear everyone's updates. Nice to see you all. I'll get my camera off because my hair's getting a bit long. I look like I've been wired into the mains. So the Bears are doing loads of stuff as always. We've got a deal with a big university coming up, which is for the running teams is going to be really good. And over 50% of that service level agreement is going to be on disability sports. So everything from girls wheelchair basketball to their Bucks teams to their Inspire a Generation program that BWB launched. So all of that's being signed up this week. The wheelchair stuff will start from September through the university. But as I say, just loads of it. Then we've got our main wheelchair basketball should be back within the next few weeks. So BWB released their return to play matrix on Monday. And then they've got a webinar tomorrow night, which I'll jump on, which will then give us all the details for getting back. But yeah, it's all good. It's all good, really. You know me, I'm not up to much. Just do be doing. Oh, with the social prescribing, we've got something going on where we're putting medical centres versus other medical centres. So it's almost like doctor v doctor, you know, so we'll get a team of doctors, pit them up against another team of doctors, get them doing wheelchair basketball against each other, so that then they can signpost people into wheelchair basketball afterwards. And I've just had an email from 2 different university departments, the physio departments and their occupational therapy departments, and they want to run programs with us to piggyback on the courses they're doing at the uni. So that will go into this agreement that's being signed on the 1st of April as well. And it's a 2-year deal, and over 50% of it is all around wheelchair sports. So we're just doing a few bits and pieces here and there. We're just ready to get back to reality.
Amazing. Thanks, Ricky. Yeah, as always, you're busy. Can I just ask a quick question? Because you're such a great advocate in this area, and I know you're working so hard, and it's great that obviously in terms of the wheelchair basketball and wheelchair sports, there's going to be kind of a predominance on that and working with the uni. In terms of kind of that wider social prescribing and referring through medical and social care workforce, how can we try and ensure that they're aware of the bigger picture and other opportunities? I know we've been talking for years and years about, you know, an activity directory finder, and I don't think we're maybe quite there for something across the whole of Sussex, but we are trying to understand what is, you know, there locally. So I just wondered what you think the best way is, because obviously from a capacity point of view, I don't want people just bombarding you with lots of information, but how can we as a network work with you to ensure we're, you know, getting the message out there that there is lots of stuff going on?
So what I always try and do whenever I do anything like this, I tell them about the other sports as well, you know, and I try and just sign, like, so I've been working with a local medical centre in East Brighton, and it's through their network of sort of these kind of Zoom meetings that I go on, and I say, look, don't just go down the wheelchair basketball route, look at the other options that are there. So this forum is always a great place for me to find out what's going on, but also, you know, I'd recommend people do the same thing, really. Just go through your local NHS or your local healthcare centre, and then sort of almost infiltrate them a little bit. And then once they get the sniff of it, you kind of you've already sown the seed. So I've not had to do that much. I've just sort of ticked a few boxes and then turned up and annoyed them. But they're really
modest. You do a lot. You do a lot. You've done some great work. You are too modest with your, because it takes a lot, you know, to knock down those doors and get in there and have those conversations. It's not, it's no mean feat.
Also, our venue over in Lancing now, we had 4 outside multi-use games areas, and we've managed to get funding to re-kit all of them out now with new outside basketball hoops and courts. So it's all floodlit, all outside sports that we can use for the wheelchair teams and the running teams, and that's all been fitted, done, completed. It was all done in time for the 8th of March when the schools opened. So it's probably one of the best basketball facilities anywhere in Sussex. It's got 4 multi-use outside areas and a twin court inside, which is all done. And we've got another load of funding which we've put in more resources and chairs into 2 more universities, so that from September when we start, we'll also have sports wheelchairs based in 3 different venues across Sussex, all ready to go. And everything from teaching, coaching to table officialing, all the bits that go on the back of the sport will be in place, so that as we make the sport bigger, we got all of those other ingredients coming through as well, like extra coaches, extra table officials, and referees as well. So the students that are at the university can learn about wheelchair basketball, but also how to get involved in it and stuff. So we're good. We're just trying to tick as many boxes as we can.
Brilliant. No, it's fantastic. It's always great to hear what you're up to. Thank you. Al, can I go to you next?
Yes, hi. So for anyone that doesn't know me, I run the sport and physical activity at Charlie Heritage Foundation. We've been really kind of in our own little lockdown, because pretty much all of our users are extremely vulnerable. So I think it's mainly just about opening up. A lot of the children and young adults have really sort of suffered in terms of their physical activity during the last year. So we're really just keen on opening up again. You know, we had a really great thing with a route going with this sort of interleague table cricket competition, which was brilliant. We were bringing local schools that had PMLD users, children with PMLD, into the foundation, into our sort of unique sports centre that had facilities that were appropriate for PMLD users, so that they could participate with each other where maybe they possibly couldn't beforehand. So the main focus really is just hopefully opening that up again at some point, and allowing those children to be able to be more active again. We've started things like the hydrotherapy and rebound therapy again, which has been good, but we're not getting through as many users as we potentially had done in the past, so wiping down equipment, all that kind of stuff afterwards. So yeah, it's definitely challenging, but we're excited really just to sort of open up again.
Thanks, Al. So just a quick question on that, because obviously the new centre and the work that you were doing around that, in terms of external people booking, that's kind of on hold really, isn't it? Because I guess, you know, the predominance is around your own your own clients and children that are attending.
Yeah, just for the moment, we are just about to launch a booking system, so like an external booking system, which will be brilliant. So we'll be able to open it up to the community. But for the moment, it's actually a classroom at the moment. So the actual sports, the sports hall is being used as a social distance classroom, which is a shame. But yeah, I think we're planning for sort of September, we'll be able to open that up to externals again, which will be brilliant.
Brilliant. Fantastic. Thank you. Paul from Albion.
Hello. So Paul, disability manager. I think everyone knows me anyway. We've actually been back up and running for about 3 weeks now. We've done 3 Saturday sessions over in Brighton, taking advantage of the obviously the exemptions on there. We sort of just we sat back and waited until everything felt a little bit easier, and once schools went back, it just felt a bit more appropriate for us to be able to do something. So we treated it as a bit of a kind of pilot, I suppose, to get back going. We did it on a first come first served booking bit, but we had 68 players attend every week. So you know, we could have easily had another 20, 30, you know, no problem at all. And then we restarted more of our sessions last night. We've got some more going tonight. Again, we probably had about 50 players turn up last night in a couple of hours, which is really good. And then we've got some Easter camps happening next week and the week after, and we resume all of our normal sessions from the 12th. So yeah, we're you know, pretty much on track to get everything going again. Some of our talent programs are also going to resume, which we weren't able to get going before, so that's been really positive. Probably our one slight downside we've had is our engagement with schools. We just, you know, it's still been a real battle to try and get in them and do some of that and deliver in there. And you know, it's very understandable given their circumstances and stuff. And we're just trying to be there as a supportive partner as much as anything else, and be there in place when they're ready to resume. So yeah, it's been a busy time. I'm fortunate we've got all of our community coaches are coming off of furlough on the 1st of April, so we've got our workforce back, and at the moment as a charity we're taking the decision not to furlough any staff from the 1st of April as well. So we'll have a full kind of cohort of staff and resources, which will make a big difference, and that is literally the first time since March we've been able to make that step. So really positive on lots of fronts, and I'm just thinking I need to ring Ricky in a minute and tap into him again and all these wonderful contacts he keeps making.
Brilliant, thanks Paul. Jackie. Oh, and just before Jackie goes, I'm aware that we are at 12:30. There's only 2 people left, but if you do have to pop off, understand. But you know, we can keep going for as long as people want to go. So
I'll be very quick. For me, I'm continuing to work for Freedom Leisure, and not just badminton, but moving over to active communities work. So that's great, and it's lovely to hear from all of you and all the fantastic things you're doing. Like all the other leisure centres, Freedom Leisure will open as soon as they can, 12th of April. And fingers crossed that we get back up to where we were before. Thank you very much.
Thanks, Jackie. Always lovely to have you. Shani.
Okay, I'll be very quick. First of all, I just wanted to say, and we are going to be doing, for the Brighton and Hove people, we are looking at doing Take Part this year, and we're going to be running it in September. And it's going to be different, but we're going to be supporting clubs we'll send something out to everyone. But I wondered if, you might be doing this, Jem, but is there any way that people could just do bullet points, brief bullet points of all these last things? Because what I'm trying to capture is really simple ways of, like, around social subscribing. You know, our health trainers, we're doing that a lot in our team. And there are, that is all, and as Ricky was saying, in East Brighton, and it would be really good to just get real pointers, bullet points of things, and it does only apply within our team for Brighton and Hove. But yeah, so when you get the interest about Take Part, do sign up, and there's a small amount of money which won't be jumping through hoops. That might be for some equipment or something. So all my update really is, we're starting our health walks. That's something that I run with Grace Air and wider. I'm really hoping we can go back on the 15th, but I'm waiting to get kind of that definite. It's got to come through Ramblers now. So but we're looking at that starting on the 15th, continue our work with Grace Air, and that's when I can start, because Richard, it was really good to hear about your portal, and I haven't signed anyone up yet because I needed to do it as people were starting these activities. So we'll be hopefully signing up some people to the Round the World Challenge from that, and the money the small amount of funding we got for the walking diaries, which I'm working on as a publication, and then that can go out. So yeah, just stuff around the walks, and I am in touch with Jackie, continuing how we can restart our badminton, but that's going to be with Freedom opening up. So we are really looking at that. And lastly, I just really want to push in our team. I'm not a disability officer in our team, just to be clear. It's just an interest I have. So, really it needs to come out to all of our team, and it's just around the inclusion. And, we do, when we bring sessions back, I just really want to keep pushing that, people can attend some of our sessions that we're running if they have a disability and a learning disability. And I really need to really disseminate that more and get people's confidence up, because there's no reason why disabled people can't be accessing our online FunkFit. It's just making that step, But that's it from me, really. It was just around the bullets. It would be great to share that and get that out. Thank you.
No problem. So I don't know if you've been hearing, but I've been tapping furiously. So I have been making notes of what everyone said. It might not be as comprehensive. And if there is anything specific that people want me to include, then just, email it over to me or pop it in the chat now. A few of you have, so I've kind of picked up what Paul said. But yeah, I think it's a tricky one, because you don't know who's going to turn up on the day, but maybe in advance people pull some kind of bullet points together, so that can be easily pulled together in advance or afterwards as well. But yeah, it's a good
we do that into our team meetings, and actually now, instead of, because it's hard note taking all this, isn't it? Just we all send some brief bullets in that, but yeah.
I think it's a bit of a work in progress with these kind of online forums, and we've moved away from maybe just that kind of topic focus and presentations, and more of this kind of opportunity to update. So yeah, any kind of pointers or things that will be really beneficial for the network, that's what I kind of want to hear, really, because this is for you guys, as much as it is for us, for learning and finding out what you're doing and where we can kind of connect with you. So before I kind of wrap it up, just on that point of view, I think I just wanted to give you an update of some of the things that we're doing. I mentioned about the social prescribing, but kind of linked to that, we're part of the National Academy for Social Prescribing Learning Together programme, and that's about bringing partners across wider sectors, so not just physical activity, but culture, kind of green spaces. And there's a lot of learning that's happened, which is great. And what I'm obviously keen to do is ensure that then there's connections with kind of other partners. But just getting, for instance, we had a call with Whistle Stop Art yesterday, and they're predominantly arts and creative CIC. But they've been doing some work up in Horsham with Age UK for supporting people with a visual impairment, and doing kind of, they said it's podcasts, but they couldn't call it podcasts because the individuals didn't know what a podcast was. But they talked through a walk, and then they gave the individuals a craft kind of to do afterwards, so that they felt like they were doing, they were going on the walk themselves. And then it's increased their confidence, and then they've gone out with their families because they know, oh, there's a step coming up, or there's some areas where I need to be a bit careful, or I need to ask for support. And they're now looking at how they can kind of do those walks within like the grounds of Age UK. So again, it's a walk maybe in Petworth Park they're listening to, but they're just walking around the garden and they're listening to the sounds and they're listening to kind of what they're seeing. So it's just kind of, highlight that we're starting to better understand what other sectors like the arts and culture are doing, where there's a clear link into kind of physical activity, and how we can hopefully kind of connect up partners. So the resources that they've got for that, Luna's sharing that with me, and I'm going to share it through the Disability and Sport Network, because they've got these packs that then anyone can use. So for instance, Bob or Richard, and Shani, thinking about your health walks, there's probably resources that could go alongside some of the bits that you're doing. So I think, it's quite exciting kind of piece of work. And then the other kind of focus for myself at the moment is the This Girl Can network. So we launched it at the Active Sussex Network, and we're just planning kind of our first forum. And it's actually going to focus on the menopause and physical activity. When I was talking to one of the ladies who's hopefully going to be speaking, she's called Jo Fuller, and she founded the Merry Menopause. She was mentioning around dialogue with individuals with a disability around the menopause, and how healthcare professionals can support that conversation, because she doesn't know if that's something that happens, if carers or individuals are really aware of kind of the menopause. One, are they aware of the menopause? And two, what those symptoms might be, and if someone with a learning disability, for instance, is able to kind of communicate that they're having kind of certain symptoms, and actually that's related to the menopause. So this is really kind of more of a shout out and an ask whether anyone on the call has done any work in that area, and specifically working with people with a learning disability, and if they have, perhaps we can kind of pick up a conversation. But if not, then I think as well it does show that's maybe a bit of a gap. And she was talking about maybe a quick easy read. So we were talking about all the things around just COVID and ensuring information is easy to consume. So maybe it's something we do around that, but also just really reiterating that the menopause can be the symptoms can be supported by being active and looking after your kind of physical well-being. So that's just really a shout out and almost like a little heads up that's what's coming up. We're going to launch the date of the forum on Thursday. So if you're interested, please kind of sign up. But have a think. If you know of anyone that might have that type of background info, please let me know. And I won't go on any further. I could, I could, but I think I'll stop there before we run over too much. So it's just really a final call out whether there are any particular things you'd like to focus on for the next forum, which will probably be towards the end of May, beginning of June. You don't have to tell me now if you don't have anything off the top of your head, but you can just drop me a message. I will send an email out to the Disability Sport Network champions again, asking if they've got any thoughts. But yeah, just again a request. I want to make sure these are relevant to you guys, really. Shani?
Just that the arts and health stuff, that's obviously something that is really, I'm really interested in, and there's a few things kind of waiting at the moment to hear about funding. And the menopause stuff, I haven't called it that myself, Merry Menopause, but I am enjoying it currently. So I'm interested in kind of doing something around that going forward. But yeah, just wanted to put that in there really. I'll put some ideas down for thoughts about next month.
Yeah, please do. Maybe the kind of like, yeah, the health social prescribing stuff, that's a good conversation as they're starting to ramp up, and we're making more connections. Thank you so much once again for all your time, and yeah, be in touch.
Thanks everyone. Thanks Nicola as well for the presentation.
See you next time. Yes, thanks Nicola.
Thanks. Bye.
Bye-bye.
Gemma,